from the American Academy of Pediatrics.
Last year, my toddler started squinting. It happened right before he turned 3, and I knew right away that he needed his eyes checked. For many kids, though, it's not really that obvious when something's off with their vision. So how are you supposed to know as a parent? Today, we have answers.
A lot of times, if the prescription is very high, at first, the child does have to get used to something being on their face, something that's new. But eventually, they'll kind of learn to appreciate in their own way that their vision is better with the glasses. And usually, that's what I've observed.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today we have with us Dr. Sylvia Yoo, who is a pediatric ophthalmologist and an associate professor of ophthalmology at Tufts University School of Medicine. Sylvia, welcome.
Thank you. It was great to be here.
We are so happy to have you. Today we're talking all about kids' vision, specifically myopia, which is the fancy term for what we deal with at our house. So to start at the beginning, Sylvia, what even is myopia?
Myopia is a medical term for nearsightedness or short-sightedness, where vision in the distance is blurry, and usually up-close vision is not affected by myopia.
Yeah, so kids can't see far away, and the same thing is true for adults. I suffer from myopia myself. So my understanding, Sylvia, is that for our little guy, being diagnosed before the age of 3 is a little bit early. So talk to me about the ages. When does myopia typically develop, and how can we tell as parents?
Usually myopia develops in school-age children, so after they start formal schooling. And so sometimes it can develop in younger children. For example, if there's a strong family history or other genetic factors that may increase the chances of them developing myopia at younger ages. And so for young children, if they have a little bit of myopia, usually it's not really going to be a concern as far as how it affects vision development, because a lot of the things they're looking at are up close. They're playing with toys up close. They're not necessarily looking at things far away at that point. It's not until they start school, especially as they progress in school and they're starting to look at things far away, like looking at a board, when they might start having some trouble with their vision and having difficulty that they may need to start glasses.
Yeah. So Sylvia, I was definitely very reassured, right, that we were diagnosed early, that we got our glasses, that the vision development is not going to suffer, right? But I wonder for parents who want to be on the lookout, want to know what to expect when they go to the pediatrician's office, at what age do you recommend that children begin to be screened for vision problems?
Nowadays, there are different ways of doing vision screenings for children. Vision screenings are usually done in the pediatrician's office, and they can be done in school settings as well. The gold standard is to have children read a chart, usually with age-appropriate symbols such as pictures, versus having children try to read letters if they don't know letters yet. And that's usually started at age 3. But some 3-year-olds are not quite ready to be able to even read a chart. And so there are these photo screening devices to be able to do vision screenings in younger kids and in 3-year-olds who may not be ready yet, to be able to look for any signs that there might be something going on that is going to affect how their vision develops.
Sylvia, I have to be honest with you. In our office, we do not have these photo screeners, but where I bring my little guy, his pediatrician does. And I was a little bit surprised. I was sort of like, what is this thing? It's sort of like this blinking lights device. I was mesmerized by it. So tell us a little bit about how these photo screeners work.
The photo screeners use the reflection from the back of a child's eye to be able to look for any significant refractive error or glasses prescription. They can look at the symmetry of how the reflection from the back of the eye looks. They can also look for things like pupil asymmetry. And you think the way they work is kind of like in pictures. Nowadays, with the good cameras that we have, that it doesn't show up anymore. But a lot of times there used to be red eye in some pictures because of the reflex from the back of the eye. So these machines kind of use that type of reflex to be able to look for conditions that may affect how vision develops.
Yeah, and for parents to, I guess, wrap their minds around what it may look like, it's sort of like looking into a camera, right? For the toddler. You can explain it better than I can.
Yeah, so actually the way that these devices have been developed, they don't have to get close to the child. They can be a little bit further away so that it's not as scary for a young child.
Yeah.
And they have something that may engage their interest so the child will look at the machine to be able to capture the information that's needed with a steady gaze just for at least a few seconds to be able to get the picture that's needed.
Yeah, I love it. And, Sylvia, for us, as I mentioned, we're still using the quote unquote old fashioned way of screening, which is having kids look at shapes or letters. And honestly, every single day that I see patients, I send at least a couple kids to you, the pediatric ophthalmologist, for failed vision screens. And one of the questions that comes up a lot in my practice is, what caused this? For a lot of families, as is the case in our family, either mom or dad have a history of wearing glasses. And when I refer them, they're like, yep, this runs in the family. But other families are taken aback a little bit and they'll tell me things like, but doctor, I really try not to let my child have too much screen time. So my question to you is, how much of myopia is genetic and how much is it a result of certain behaviors?
I think there's certainly a genetic component that we're aware of, but in recent history and in projected numbers looking at how many people are going to have myopia in the future, genetics doesn't explain why so many more children are developing more myopia. And so I think what's happened is that with the addition of screen time, in addition to everything else that children are doing up close starting at a young age, looking at books, playing with toys, I think it's just added to the amount of near vision activities. And something about that seems to be causing a lot more nearsightedness to develop.
That is so interesting. And it's, the case in so many things in medicine, right? There's not one reason.
Mm-hmm.
There's multiple reasons why children may not be able to see far away these days as well as they used to perhaps in the past. So, Sylvia, let me ask you this. Once kids are screened, referred, they're prescribed glasses, are the glasses forever? And I'm asking you this because I always thought the answer was yes. Once you get glasses, you sort of have to wear the glasses for good. But our pediatric ophthalmologist made a comment when we went into the office. He sort of said, vision can still improve in the early years. So help me understand this.
The size and the shape of the eye changes a lot in the first several years of childhood. So the nearsightedness could potentially decrease a little bit because of the way that the shape and size of the eye is changing. Usually when a child has nearsightedness, especially if it's a significant amount of nearsightedness, I'm not sure that I can say that they're eventually maybe not going to need glasses, but certainly it's something that could happen. And it'll depend also on how much nearsightedness that they have and how that's changing as they get older.
Yeah, so it may improve, but we may be wearing the glasses for good, potentially, even if it does improve.
Yeah.
So, Sylvia, any tips on actually keeping the glasses on? I have to tell you, we struggled very hard for the first month or two. It's gotten better, but it's not perfect. There are many days that he does not want to wear his glasses. I see it in my practice so much as well. So, how do we keep them on?
It can be a challenge, especially if it's something like a lot of asymmetry in a prescription where the vision is fine in one eye, there isn't much of a prescription. And so as long as the vision is good in one eye for children, they function very well. And that's another good reason for vision screening is because you may not, if there's nothing outward that the parent might be seeing the child's eyes, they might not be able to pick up on something that could be affecting just one eye. A lot of times if the prescription is very high, at first, the child does have to get used to something being on their face, something that's new, but eventually they'll kind of learn to appreciate in their own way that their vision is better with the glasses. And usually that's what I've observed. Sometimes it continues to be a challenge until maybe school age where they're starting to have to look at things in a little bit more detail. But I just try to keep a close eye on them in my office and then encourage the parents. And as the child gets older, ask the child to also I talk to the child directly and ask them to please wear the glasses all the time. And then I try to make a joke like, you don't have to wear them when you're sleeping. So try to make it a little fun.
I'm going to try that at home. You can take them off for sleeping, right? At least. I love it. Now, I do also want to ask you, what is the recommendation during sports? We're a basketball family in this house. I've talked about it on the podcast. We're hoping to be a soccer family too. What do I need to do when he's actively playing these types of sports?
Younger children, I think if they need their glasses to be able to feel like they're comfortable playing the best that they can, sports goggles are a great option. And the nice thing about sports goggles are that they are also protective of the eyes. Basketball is actually one of the sports that has the highest risk of injury around the eyes, but it's not one that using protective eyewear has caught on. So professionals don't wear it. And so in turn, children are not going to wear it. But I think that's always something to keep in mind, whether or not glasses are needed for vision.
Fascinating. And I have to be honest, he's still very much doing little drills. We're not going really hard on the team sport end just yet. He's only 3 years old.
Yeah.
But as he gets older, and I imagine that's also true for teens, right? Teens who play basketball. What other sports would you say as kids get older that you would really recommend those sports goggles for?
I think that basketball is the number one. So there's a lot of sports where there is a lot of contact that occurs, like football and hockey, but in those sports they do wear helmets, so there's a little bit more protection around the face. Soccer too, I think there can be injuries, inadvertent elbows to the face, things like that could potentially cause injuries. But I should mention too, as the child gets older, despite my concerns about injuries to the eyes during sports, contact lenses can still be an option for older kids. I kind of have this arbitrary number of age 12 for contact lenses for children, but some 12-year-olds are not ready. And then some younger kids I've had who are really interested and wear them for certain activities where they have difficulty with glasses.
I love that. And thank you for reminding us of that option because contact lenses, of course, are so important as kids get older. Sylvia, one more question about the sports goggles and then we can move on. Help us understand what they look like and how they work. Are they just goggles that go on top of the glasses? Help us understand.
They are prescription, so the lenses in them are prescription, and they kind of wrap around the head a little bit more tightly, and then the frames are thicker, and so they're just less prone to breaking if something hits the child in the face.
Got it. So it's an alternative to wearing your glasses during sports, and you do have to go back to your pediatric ophthalmologist and get a prescription for your sports goggles. Is that correct?
You can use the same prescription as your glasses. They usually also a lot of times have a strap in the back just so they stay on while they're running around. And I have some patients who like wearing sports goggles all the time. And so some kids just wear those.
Fascinating. See, and now I'm really glad I asked you that question. And of course, I have to ask you, are these covered by insurance?
That's a tricky question. It's very, very insurance dependent. Some people have separate vision plans. And so there can be, usually it's partial coverage, just depending on the types of frames. It depends on the insurance as far as how many pairs of glasses might be covered, how often they can be replaced if they're lost or broken. So it's a little hard for me to answer, but usually there is going to be some coverage depending on what insurance you have.
Very good to know either way. Sylvia, last but not least, we like to end every episode with what we call a parenting prescription. So when it comes to myopia and vision problems in general, what is one thing you want all parents to remember?
Well, one thing that I didn't mention earlier as far as why so many more children are developing nearsightedness is there's a thought that children are generally, and all of us as a whole, are just not spending as much time outside. So that's also something to keep in mind. And I think that it's something that's being encouraged by the AAP for mental health and physical health, but it's also really important for eye health. The reason that spending time outside when the weather is good and why that's good for the eyes is not completely clear, but it does seem to be an important factor in why kids are developing more nearsightedness. So that's something to try to encourage, try to do a little bit every day when you can. And then taking breaks from screen time. It's hard, especially as a child gets a little older, because screens are used in schools. And so it's not only screens, it's anything up close. So some children who are really avid readers, it's just good to try to take breaks from looking at things up close when you're doing that for long periods of time. And then in addition to spending time outside when the child is able, an important thing to remember is taking breaks from looking at things up close. And one way to remember that became popular during the pandemic when people were looking at staying inside and looking at screens a lot more was this 20-20-20 rule, where every 20 minutes you take a short 20-second break and look at something far away, 20 feet away. And that's just one way to try to help keep track and remember to take those breaks when you're looking at something up close, whether it's a screen or even reading books for a long period of time.
I love it. So more breaks from screens, more time outside, always such good ideas for all aspects of our health. Thank you so much, Dr. Sylvia Yoo, for joining us today.
Thank you. It was great to be here. Thanks for the invitation.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Doug Nagel,
Jackie Ortega,
Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.